Hey everybody, welcome back. My name is Melanie for those that are new here, and I just got done doing an interview with the Patient Story, which is a platform that helps those that have gone through cancer, are going through cancer, or other medical issues, diagnoses, and they share patient stories. So I recorded an interview with them that should be up in a couple months. I will share it on here once it is live, but definitely check them out. They're a great resource for anyone going through medical issues. But a lot of what we talked about, I shared my story, but we also talked about motherhood and cancer, but also mental health and cancer. And this is actually a video I had been wanting to make for a while and figured while it's kind of fresh in my mind and I was just talking a little bit about it, I would kind of expand on what I was sharing in the interview and just share it here in case it helps anyone else. Because if you have been following, you know I've been sharing my cancer journey. If you're new here, I started sharing about my cancer basically when I was diagnosed. I was diagnosed with cancer when I was 30 weeks pregnant, delivered my sweet baby girl at 32 weeks, and started all of my treatment. It's now 16 months later because she's 16 months old. So 16 months later, I am currently considered no evidence of disease. Yay. But obviously there have been some changes to my life. Cancer changes you in immeasurable ways, whether it's physical, whether it's, emotional, internal. Cancer changes you. And mental health is a huge aspect of cancer that I don't think very many people think about. Like, you think cancer, you want to heal physically, you want to get rid of the cancer, you fight to get rid of the cancer, you do what you need to do to get rid of the cancer. But at least for me, my physical health, yes, was destroyed as well. But my mental health took a huge hit. And so I just kind of want to share what that looked like for me, how it changed my perception of mental health, and why I think it is important for anyone going through medical trauma, even outside of cancer, to really prioritize their mental health. Your physical health is important. Your mental health is just as important. And so for me, a little bit of a backstory. I've never really had, a lot of mental health issues, at least that I knew of, really. I've come to discover that I suppressed a lot of my anxiety and it came out physically in my body, as opposed to recognizing that I had been dealing with anxiety longer than I thought I was. But I had, I've known people that have, depression, anxiety, they treat it, but that was just never something that I dealt with. And I always thought the closest I came to depression prior to cancer was when my brother passed away from a drug overdose. Just, grief, depression, they can look similar. And so I had some really rough days, really down days for a long time after he passed away, trying to cope with that mentally. But they were never anything that were really impacting my life. And I always said that if I was ever faced with severe mental health issues, or not severe, that's not the right word, but if I was ever having ongoing mental health issues, I was going to try and treat with supplements. It was like, people say they use these supplements, it helps with their anxiety, it helps with their, depression. And so I was like, I'll go that route. I'm not going to take antidepressants. Well, enter postpartum and cancer and radiation and medical trauma and losing my eye. And I have now changed my viewpoint on that, because sometimes it is necessary to use medical intervention to help with your mental health. For me, I did great through chemo. I had my baby. I started chemo 2-3 days after she was born. Great is a relative term. I did well on chemo. I wouldn't say great, but I didn't get nauseous. I tried to stay upbeat. I tried to stay positive. I am, for the most part, and was before, a very glass half full, try to look on the bright side person. So I went into chemo. I was like, I'm going to share this experience so that maybe it'll help someone else. The good, the bad, the ugly. Gratefully for me, my worst side effects from my first chemo were mouth sores, never got the nausea, and very grateful for that. But I did lose my hair, going through the trauma of that, and your appearance and all of that. But otherwise, for the most part, I stayed pretty upbeat during chemo. It wasn't until after my eye removal surgery and then starting radiation, which I did a radiation and chemo combo, that completely wrecked me. And this was relatively 3 months postpartum, so take that into consideration. I'm also postpartum. I don't know if it could have been that I was also experiencing postpartum depression, if I was experiencing depression from not being able to leave the bed, not being able to keep down food, the toll radiation takes on your body, on your schedule, on your life. We had moved out of our home and into my parents' home because my care was in Orlando, and that's where I needed to be. And I also needed help. I had a 3-month-old baby girl. My husband his work was incredible and very supportive, but he did eventually have to go back. And so we needed someone home with me in case I was having any issues and couldn't care for her. And there were a lot of days that I couldn't. We needed someone there. But the days were getting rougher as I continued to go past my eye surgery, further into radiation. And I was just having some very intrusive thoughts that I had never had before. And I think when you're faced with cancer, your mortality becomes relative, if that makes sense. You question your own mortality every day. Well, especially when the cancer is still there, when you still have a tumor growing inside your face, heading up to your brain. I just, in my mind was playing so many tricks on me that I was just going to die any second. And I was in so much pain and so much I couldn't eat. I couldn't drink like what I wanted to drink. I was drinking boosts every day just to keep myself functioning. And I couldn't even drink the amount that they were wanting me to drink. I was losing weight. I was very, I was not able to get out of bed. Days were really dark. And then it got to the point where I was getting very close to having a mental breakdown. And I am so grateful for having friends who know more about mental health than I do, and who have been through it. But basically, my friend just came to me and said, this isn't an option anymore. You need help. She immediately got online, got me a psychiatrist. I met with them the next morning, and they prescribed me basically Zoloft. In the meantime, my radiation doctor also prescribed me something for anxiety. And I remember like fighting my mom because I was like, I'm not taking it. I'm not taking that. I'm not taking that. And then finally, I had one day where I could not get it together enough to feel safe, to feel my whole body just felt like it was revolting against me. And then my brain was too. And so my mom was like, please just try, take one. And so I took one of the anxiety meds, and within an hour I was calmer. I could think clearly, and I said, okay, I need to be open to using this intervention at this time. So I went ahead and went on the Zoloft that the psychiatrist prescribed, started at a small dose, upped it just a little bit, and it took a little while, but within a week or two, I was back to feeling more like myself. And that made a huge, huge difference in the way I was able to cope with what was happening to me. Did it make things completely great? No. I still have days where I struggle, days where I still wasn't able to get out of bed physically. So there was that still going on, but I was able to be more present. I was able to like have the baby come into the room, and she would play on the bed with me for, an hour, versus before I couldn't, like they would bring the baby into the room and I would be able to be with her for 2 or 3 minutes, and I'd be like, I can't, I need someone to take the baby. And because I felt like sitting in the bed for her, I felt like that wasn't fair to her. She was an infant. What else, sitting in a bed is fine for her. But I felt like I felt like I couldn't be around her. I just felt completely outside of myself. And like I said, whether it was postpartum, the trauma from everything going on, or a combination of all of them, I needed something to help me. And I am so grateful that I finally agreed to do that. So please know that if you are similar to me and had sworn off any kind of mental health assistance, like medically, and you're going through medical trauma, like a physical medical trauma, it is okay to need mental health help too. Whether it's seeing a therapist, getting medication that's going to help you, please, please, please take care of your mental health just as much as you're taking care of your physical health. Chemo is also a medical drug. Zoloft, also a medical drug. Do I want to take either one of them? No. Did I need to take both of them? Yes. I needed the chemo, and for a while I needed the Zoloft, and I am currently still on it. May talk about weaning down because I've gotten to a very stable place, and I've been stable for a long time. I'm grateful that it was more of a situational depression and anxiety, and not, a lasting one. We'll see what happens as I start to go down on the Zoloft. But it was needed. It was necessary in order for me to be the mom that I want to be the self that I want to be. I want to be my glass half full. I want to be hopeful, especially going through something like cancer. When you're living in doom, that's just causing other issues for your body, even physically, when you're constantly doom and gloom and I'm going to die, and you're going through all this treatment that honestly makes you want to die some days. It's okay to get help. It is okay to not be able to do it on your own. And that, for me, that also includes prayer. I had my faith that was helping keep me going. And, I used to think my faith will keep me going. And it does, but so does the medical interventions that were helping me, and are continuing to help me. So please just prioritize your mental health, because I think that so often that gets overlooked when you're trying to get cancer out of your body. But I also think that mindset, when you're trying to get cancer out of your body, is huge. And if you think it's not going to go away, there's power in that. Versus if you're able to get into a good space mentally, and you can tell your body, my body is healing, my body is capable of healing, I think that that helps a lot. There's power in that too. There's power in your body feeling like it can help you. And so I just highly encourage you to please prioritize your mental health just as much as your physical health if you are going through medical trauma. I pray you have a friend who, if you cannot see it for yourself, will point out to you that you need help. And if you're that friend who is seeing your friend need help, please say something. It can make a difference. I am so grateful. And I started doing other things. I didn't just rely on the Zoloft, though that's helping. I am also I have the Calm app now. I been working on, just trying to cope with calming my body in other ways as well. But you just look for the things that you need to do to help your body and your brain feel safe, I guess. And that was the biggest thing. It helped me feel safe again. Before, when I was just having those really, really dark days, a lot of it was because I didn't feel safe. I wasn't sure I would be able to see my baby grow up. I wasn't sure I would be able to, touch my husband's beard anymore. Just weird thoughts, Not weird. I shouldn't say that. That's not true. When you're, like I said, when you're faced with something like cancer that you feel like could make you dead before you want to be dead, it's scary. And so you just have all these thoughts in your head, and you also wonder, what could I have done anything different? Did I cause this? Just thoughts that just start circling and circling and circling through your head. Do I need to go completely vegan? Do I need to do this? Do I need to do that? You get so much input from so many different places. You've got doctors telling you one thing. You've got people on the internet telling you, drink green juice. And maybe a combination of all of it would work. I don't know. But your brain is just going haywire. And so focus on it. Your brain is going to go haywire, and you need to do what you can to help it sort everything out so that you can stop those thoughts of just, I call it the doom cycle, like do the doomsday cycle. You don't want to live there. It's not a good place to live. And I do still have moments where I, worry, am I going to make it to her 10th birthday? But I'm currently cancer free. I pray I remain cancer free, but I'm just using what I can to get to the next stage of her life. For example, early on, I had two prayers pop in my head, just random. I just said, I want to take my daughter to Disney and I want to see her ski. Those were the two things. And next month, we're going to Disney. My parents gifted us Disney passes for Christmas and we're going. And so that's giving me something to move forward to. If you can find things in the future to help you look forward to something, do that. I mean, book a vacation 2 years from now so that you have something 2 years in the future that you were aiming to go to. For me, the next thing will be skiing, and she's not going to ski for at least another 2, maybe 3 years. She's 1. I don't think they even let kids do ski lessons until they're 4. So I have something 3 years in the future that I am aiming to get to, and that gives me hope. And if you can hold on to hope, I think that helps your mental health in a huge way as well. Just whatever you can do to give your mental health the help it needs. So I hope some of this made sense. If it all you need to reach out, if you need someone to talk to, I'm open to answering any questions, to being a support, because that is again another huge thing I would say or recommend for anyone going through cancer again or another medical issue. Find someone who shares a similar story to you. For me, that's been a little hard just because I don't know a lot of people diagnosed while they were pregnant or who have lost an eye, but I've connected with a woman who basically had very, very similar cancer to me, also lost her eye. She's at a very different stage of life than me, but I have now had a gentleman reach out and I have connected with him. He's going to be having the same surgery. Having people you can talk to that understand where you are coming from and just having that camaraderie really is also so helpful. Cancer is just very isolating. You can feel completely alone even if you have the most supportive village. And I do have the most supportive village. And there are still days where you just feel like no one can understand. So finding someone, even if it's someone you connect with online that you can speak with, I think is also huge. So just from me to anyone struggling, you can reach out, but please speak to someone. Find someone to talk to. Your mental health matters. It really does. And it affects your physical health. I fully believe that. Your mental health will affect your physical health, and it needs to be given just as much of a priority. So, all right. I think I got all the thoughts out. If I didn't, I'll make another video and share that. But thank you for listening. And again, thank you just for being so supportive. All right. Bye, everybody.